Hi everyone, it's me, Dr. Kahng, cosmetic dentist. Welcome back to my channel. Today we're going to talk about whether veneers can be used to fix crooked teeth. Before we move forward, please hit the subscribe button so you never miss one of my future videos on cosmetic dental procedures. A very common question that I get as a cosmetic dentist is whether veneers can be used to straighten out or align crooked teeth. So I'll cut to the chase. The answer to that is yes, but only to a certain degree. In more moderate or severe cases, it is not recommended, even though it could potentially be done. So there is a distinction between what is possible versus what is recommended. Yes, it is possible, but is it recommended? That's what we'll dive into today. I wanted to start this video with a little background on me. So I've been a dentist for 12 years. Several of those years, I was also a professor at USC School of Dentistry. And I've really evolved when it comes to my preparation style and what I feel is important. These days, I really prioritize minimal removal of enamel. And that is beneficial for your tooth because every time we drill a tooth, there's a chance that the nerve can be affected, first of all, but also that once the enamel is gone, it can never come back. So it's really, really important to try and preserve as much of the tooth structure as possible for the health of the tooth. Even though I am a cosmetic dentist, it doesn't make sense to completely destroy a tooth just so that it can look better. At this point in my career, I am established enough to insist on what I feel is right. I have to have a little bit of a backbone for my patients because patients don't really know what they're getting themselves into when it comes to veneers. I do. I'm the professional. So I have to recommend what I think is right for the patient. Now, doing this can be a little bit of a buzzkill. Like if you wanted veneers and you wanted your veneers now, which is what a lot of people want. They want it now. And your cosmetic dentist said, but first, I think you should do braces or Invisalign. I think you should straighten the teeth first. Most people will walk out the door because they don't want to do Invisalign and they don't see the benefits of doing Invisalign. So let's talk about the benefits of straightening up the teeth first. Straightening up the teeth can be incredibly beneficial for the final result. When the teeth are straight, now we can focus on the cosmetic enhancement while still preserving as much tooth structure as we possibly can. And why is that important? Because veneers only last average 15 years. That means if you're getting it done and you're 30 years old, you need to replace these every so often. And every time you go in to do this procedure over again, you're removing just a little bit more tooth structure or you're working that much closer to the nerve. So initially speaking, it's important to set things up the right way so that there isn't a lot of tooth structure that has to be reshaped in order to do your veneer. And I would say, truthfully, 9 out of 10 times when I tell patients they should get Invisalign first, they don't move forward with veneers with me. And that is okay with me. Now, that being said, let's talk about the 3 reasons in a more concise way that I prefer to set up the teeth with Invisalign. Number 1 is that less tooth structure can be removed. And I've already said this 300 million times in this video, but that is really, really important. Let's look at this example over here of this tooth. You can see that this tooth is a little bit more buck. If a tooth is buck like that, or let's go this way, the only thing we can really do is shave it down. And unfortunately, when it's at an angle like this and we shave it down, we are working close to the nerve. So when we're evaluating a situation like that, it's important for the cosmetic dentist to assess if enough tooth structure can be removed without irritating the nerve and also getting a good result. And the last thing we want to do as cosmetic dentists is to irritate the nerve to the point where it needs a root canal, because that in itself will change the dynamic of the cosmetic result. Root canal teeth will eventually change color over time. So that adds another complication. The second reason is one that I think requires a little bit more experience and a trained eye. And that is establishing a proper bite or interincisal clearance between the upper and lower tooth. That will increase the longevity of the veneers. If you've watched any of my other videos, if the bite is incorrect, it can really increase the chances for failure of the veneer. Failure meaning that it can chip and need to be completely replaced again. So I think establishing the right bite is low-key so important. There are 2 things I look for in a bite. The first is how the teeth come together upon closing. We don't want there to be too much pressure on these veneers. If the teeth on the lower happen to be crooked, which happens to be a lot of the time, it may put a lot more pressure on certain parts of your upper veneer. The second thing I always look at is the pathway. What does the patient do when they're chewing food? What does the patient do when they're sleeping? Are they grinding? Those are some bite issues that I look at when it comes to predicting the longevity of the veneers. Now, I'll tell you from my perspective after doing a lot of these cases. Will the veneers look good initially? Yes, they will look good upon placement. What we're talking about when it comes to the bite and really fine-tuning the bite is figuring out a good position for the teeth to be in for them to last their longest. Overall, in the long run, this is what's going to save you a lot of money and a lot of heartache. So taking the time to set things up the proper way is always going to be to your advantage. Not to mention that if the teeth do happen to be crooked on the lower, for example, it'll be an aesthetic enhancement as well, and in the long run will keep your periodontal health in check. And the third reason is that you will have better aesthetic results. I think that you can get great results without doing Invisalign, but from a technical standpoint, for making things look really, really lifelike while also maintaining a minimal prep, you have to imagine that when we prepare or reshape the teeth, we want there to be an even amount of space for the porcelain. So imagine this. When a cosmetic dentist removes enamel to create space for a veneer, the ideal situation is when the teeth are aligned properly and we just remove a thin layer evenly across the tops of each tooth. However, if there's an alignment issue, there are times when we don't have the space to remove the tooth structure without maybe hitting a nerve or irritating the nerve. And so we're leaving that space a little bit more bulky. That amount of tooth structure removed is less than some of the other areas in the mouth, and that will reflect light differently with the porcelain. It's ever so slight, but I do notice these things. And I think if you are investing this much into your smile, it is important to do things the right way and also achieve the best aesthetic result that you possibly can. In the end, I practice this way because this is what I would want if I were to get veneers, or if any of my family members were to get veneers, I would do it the right way. And that's what I think patients also deserve. In summary, yes, veneers can be used to fix crooked teeth, but they shouldn't be used to fix crooked teeth, especially if there is moderate to heavy crowding. Doing the procedure this way may not feel as instantly gratifying, but there are definitely benefits, and those benefits are for you, the patient. If you found this video helpful, please like and subscribe. That's it for today. I will see you in the next one. Bye.